Okay, so this is number one capture for fluid and electrolytes since we didn't have class on Tuesday. So let's talk a little bit about fluids and electrolytes today and see what you remember from some of your other classes. So there are a lot of mechanisms in our body that help for maintaining the right amount of fluid and electrolytes. We know that things happen in the kidneys, things happen in the lungs. We lose fluid from the lungs, from the skin. We can measure some of it. We can't measure some of it. You can't go to the hospital and measure how much fluid somebody's losing if they're breathing hard, but we can measure from the kidney and an INO. So here's just an example. You don't need to know this for the test, but just an example of how much we intake fluid just from our daily eating and drinking, and then from oxidation. It ends up being quite a lot. The body ends up trying to maintain homeostasis on everything. Output is another thing that we have. So we use a lot. Look at the skin, 600 mLs a day from skin. Kidneys, of course, that's where most of it's lost. Lungs as well. So imagine somebody who has COPD, CHF, that just is always breathing a little bit faster. They're going to be losing more. So, of course, skin also depends the temperature, where you live, things like that. So let's talk about fluids a little bit. So you guys all remember from A&P and pathophysiology, we have different kinds of fluids. So isotonic fluid, as you recall, is fluid that's the same as in the blood. So we put an IV in a patient, an isotonic fluid, we know that that fluid, since it's the very same as blood, it'll stay in the intravascular system. So for example, normal saline, 0.9% normal saline will stay in the bloodstream. So an isotonic solution then would be great if patient is low in fluid in their blood, say their blood pressure is going down, we would give an isotonic solution. So that's probably the most common one I see for low blood pressure is doctor will order normal saline. Hypotonic solution, on the other hand, is fluid that is lower solute than what's in the blood. Hypertonic is a higher solute. So hypotonic solution, for example, is if you're going to give that in an IV in a patient, water then is going to be pulled out of the blood vessel and go into the cells. So if somebody is low blood pressure and you gave them an IV of hypotonic solution, that would take the fluid out of the blood and they would probably diminish and have a lower blood pressure. So an example of this is half normal saline, quarter normal saline. So hypotonic, think of it as it takes away, and that's what that's doing. Hypertonic, though, on the other hand, is going to pull fluid from the cells and put it in the intravascular system. This might help with somebody who is low in blood pressure, or they need more fluid on board. So it's going to pull from the cells. So, for example, hypertonic solution then is 5D5 in half normal saline would be an example. That's going to pull it in. So hypertonic is going to bring it into the blood. Hypotonic is going to take it out of the blood system. A couple other things that are a big factor that have to do with maintaining fluid and electrolytes is we have one of them is diffusion. So this is that diffusion you remember from chemistry, passive transport. You don't need any energy. You're not going to expend any energy. It just moves from an area of higher concentration to lower. Osmosis is passive movement across a membrane. So lower solutes to a higher is when that's going to happen. It usually stops when everything is equal. Active transport, that's going to be using the ATP, as you remember. So ATP is low concentration to higher, but it's going to be active. So for example, the sodium potassium pumps in the cells, that's used by ATP, active transport. And then your hydrostatic pressure is down in your capillaries. So how does fluid move in your capillaries back and forth across this membrane? Well, that's usually by hydrostatic pressure, and that's how we work down at the capillary level of the body and the cells. Colloid pressure is that pressure that's done by a high colloid. An example of a colloid is albumin. So albumin is going to cause reabsorption or loss if you don't have any of fluid and solutes. So albumin is a big factor in the blood. If someone is low in albumin, they are going to lose fluid out of the intravascular system. Another example is ADH. So if you remember from pathophys and A&P, ADH is antidiuretic hormone. It's produced by the hypothalamus, and it causes, if it's antidiuretic, you're not going to diurese or pee as much. So if you have antidiuretic on board the hormone, then it'll cause you to retain water, and you may be retaining water, so you're going to retain also your solutes. Your ANP, atrial natriuretic peptide, that comes from the atria, obviously from atrial. So the atria, this is where this comes from, and this basically comes from the atria of the heart, and it stops the action of the renin, angiotensin, aldosterone system. That's a mouthful. So basically this is going to decrease your blood pressure by causing vasodilation, and reduces your fluid volume by increasing excretion of sodium water. So a fancy word to say that, patients that have heart disease, heart failure, too much fluid makes the heart work too harder. It stretches more. The stretching causes the AMP to be released, causes them to reduce fluid by peeing out more, so the heart doesn't have to work as hard. There's also one called BNP. It's called brain natriuretic peptide, but that has to do with the ventricles, the same kind of thing coming from the ventricles.